some innovations that are that have been exciting in heart catheterization is actually the axis in which we get to the heart. So traditionally, we've been doing this procedure through the groin artery or the femoral artery approach. That's in your right or left groin. This we take a catheter or straw-like tube from this area up to the heart. However, more recently, over the past 5 or 6 years here in the U.S. and longer in European countries, we have a different access site, which is through the wrist. And so we have been pushing toward this because of the advantage of going through this access site, which is decreased bleeding complication with the puncture site. The advantage is that the wrist artery is the width of a spaghetti noodle. It's a very narrow artery, which bleeding issues can be controlled very easily. You can see if you're bleeding in your wrist very easily as well. It's not hidden by tissue. However, the traditional approach where we go through the groin, it involves a much larger artery, the width of my thumb. And so if there's any kind of bleeding complications with that, it is both hidden under deep tissue as well as difficult to control because it's such a larger artery. So this has been shown actually through studies to decrease bleeding if we go through the wrist. It also helps to improve patient satisfaction with the procedure because when we go through the wrist, you can actually sit up right after the procedure and you don't have to lay flat for 4 to 6 hours, which has been the traditional recovery time after a heart catheterization. We just put a clear plastic band over the wrist puncture site and blow up some air, and that's on there for 3 hours, and then it comes off after it heals.